Hello, Dr. Kate. Hello, Jay.
Hello.
Hello.
So great to see you guys. Thank you for being here with us. Let me introduce you, if I may.
Sure.
Um, Dr. Kate White and her husband Jay White, the dynamic duo behind Heads and Tails, a podcast about recalibrating life, love, and identity in midlife. Dr. Kate is a nationally recognized gynecologist, menopause, and sexual medicine specialist, and an alloy prescribing physician. We have her in-house, everybody, who leads a modern, compassionate practice for women in perimenopause and beyond. Jay is a licensed marriage and family therapist. We now have him in house too, everybody. A musician and magician who helps couples strengthen connection and resilience through life's transitions. Together, they bring humor, honesty, and heart to every conversation about what it really means to navigate midlife physically, emotionally, and relationally. Welcome. So happy to have you here. Let's get into it. I want to give people a little sort of background on who you are. Some may know you, of course, but not everybody on our platform knows all that they should. You're both in professions that allow you to go deep into women's health and relationships. How did those worlds overlap personally and professionally?
I think professionally it was we just started sharing patients, and sometimes
Really?
sometimes on purpose, sometimes accidentally. We would Charleston's we like to call a big little city, and so on occasion I would actually send Kate a patient if they were new in town looking for an OBGYN, and she would send me folks
if I
from
had,
a practice.
if I had couples that were struggling or individuals who were struggling, and we, of course, would talk about that we were seeing a lot of the same struggles that were happening, especially in midlife patients, where hormones were changing, people's perspective on their lives was changing, and they were really struggling with that adaptation. Either they personally were struggling or their partner was struggling in the ways that they were changing in their view of or maybe their partner was just chewing too loud. I mean, that was another thing.
Oh my God.
Sometimes they had to, I'm like, I think he needs to see a therapist.
Okay, listen, I'm going to try not to project too much of my own relationship, but I think it's so interesting that we hear many of the same things. All of a sudden, like the sound of his chewing, and it tends to be the sound of his chewing, not really her chewing, that just like sends us into orbit. But what you talk about, Dr. Kate, just now, this sort of like change beyond the bedroom, and I know we're going to get into the bedroom a bit, but this kind of like, I'm shifting, I don't know what's happening. Are these the kinds of things that you both would hear in your practices? What did you most commonly hear?
Oh my gosh, yes. Well, I certainly did. I mean, there are monumental shifts women navigate shifts from puberty on forward, whether there are changes, you've got hormonal changes in puberty and your body's changing tremendously. And then if you go through a pregnancy, that's going to change your body physically and hormonally. And then you go through and you think if you've gone through these things, that's as bad as it's going to get, or it's going to be as dramatic. But then we really don't, and everyone talks about this and prepares for this, but they don't really talk about it.
Then you have perimenopause, menopause, all that. And for guys, I think we don't, because you're always projecting. You see the world the way that you see it, and so this was only a year ago or so, a friend of mine and I were out. We have this little piece of property out of town, and we were putting up a basketball goal, and we wanted to put it, and he's my age, and we wanted to put it so we could dunk it. And
so lower, you mean a little lower?
Oh my gosh. Oh, listen. It was, I mean, it was embarrassing how low it had to be. And we just both looked at each other and says, man, I can't jump anymore.
Right,
And
right.
so for guys, the changes we go through, we at some point hit puberty, and then at some point put up a basketball goal and realize you can't jump as high. I mean,
Right.
I mean, of course we go through changes, but we
Mm-hmm.
don't have stages. We don't have things that, kind of markers, if you will.
Yeah,
And,
yeah, yeah, yeah.
and
I
so,
want to get to that more specifically in a little while. I'm really curious
okay.
about what men do go through.
Mm-hmm.
Um, let's start briefly, if you will, Dr. White. What's happening hormonally? You touched on this a little
Oh,
already in
absolutely.
perimenopause and menopause that can affect mood, energy, and relationships,
Yeah,
not just
so
sex.
perimenopause, we're born with all the eggs we're ever going to have, and by the time we get to the perimenopause stage, which can be different from everyone, so that time, the definitions that we have for menopause are not great because they are all based on something that someone can see and quantify, which is having your period. So if you're someone who hasn't had your period, either because you're on hormonal suppression or you had a hysterectomy, you don't really have a good definition. But the real clinical definition is a menopause is a year to the day from your last period. But this whole time when your ovaries are nearing retirement, where you're not having that hormonal fluctuation, can be up to 10 years. And so some people start those changes and feel those changes in their mid-30s or earlier, and some people really just kind of cruise along until their late 40s. And what we're seeing is the first part of your cycle is estrogen based, and you have each follicle that you have that has the egg inside it has cells around it that produce estrogen, and each of those, estrogen is like the fertilizer of the glandular tissue of your uterus. It builds up that lining tissue, so when that egg actually comes out halfway through your cycle, there's a place for it to land. And then after you ovulate, your ovary then makes progesterone. And the progesterone is sort of like the lawnmower. It thins out that lining tissue, it grabs the egg and makes it a place that it can start making a placenta.
Should I be writing all this down?
Please do.
And so that cycle goes up and down and up and down, and it's all controlled by the estrogen receptors in your brain. Because when the estrogen receptor is empty, your hypothalamus talks to your pituitary, and your pituitary sends messages to your ovaries to say, hey, we need more estrogen. And so when the ovary is like coming right up, it starts recruiting a follicle with that, and the follicle makes the estrogen, and then that your brain is happy. But what happens as your eggs age is they don't necessarily respond as quickly. And so your brain is still like, oh no, I really mean it. I really want you to make that estrogen. And it sends more of that follicle stimulating hormone to your ovary. And your sleepy ovary is recruiting lots of those follicles. And each of the follicles makes estrogen. And so gradually it gets a good egg that's recruited, and it gets one that gets dominant. But in the meantime, all this other follicles are making estrogen, and your estrogen levels, which used to go like this, are now going like this.
Right.
And you're getting much, much higher levels of estrogen in perimenopause than you did previously. And your brain in general is pretty good with having high estrogen levels, because in pregnancy, we may have hormone levels in the thousands, and in our typical cycle, when you're not pregnant, your estrogen levels might get to 200, maybe 300. So, and in pregnancy, your brain is able to handle that. What it can't handle is that plummet down from these super high levels very quickly. And so it's the change between here and here that is making your dopamine receptors and your serotonin receptors, because those are all regulated ultimately by estrogen, makes them not function in the way that they have previously. And that's what's giving us the brain fog, the executive functioning problems, increased ADD, but also mood changes. 30% increase in anxiety and depression in perimenopause. And it makes your attention to detail more difficult. So all these struggles come around into your daily life and into your relationships with everyone, with
Yes.
yourself and
Yes.
your body image and but also certainly with your partner and with at work and everywhere else. And that's where I'm like, maybe we need to see how we can manage these things so that relationships don't blow up.
Yes. I thank you for that incredible
Sorry,
explanation.
that was kind of in depth.
No, no, no. It was fantastic. And it makes me think always to my own experience, anxiety was arguably my first and my loudest symptom. I feel like I've had, let's call it like 49 of the 50 symptoms. And
Yeah.
today being World Mental Health Day, Jay, it's especially exciting that we have you here. I'm wondering what you notice in couples when one partner is going through this kind of major physical or emotional change that really is like out of her, it's her biology, it's her chemistry, it's out of her control. I hate to use that word, but there is something legit that's happening. What do you notice in your practice?
What I will, when I run into this, first of all, it was amazing how long I practiced and did not realize how often the answer was perimenopause or menopause.
Oh, talk about that. That's
That
incredible.
there
Yeah.
was a change. And what will happen is the mistake that people will fall into, a lot of husbands will fall into, is the same that happens. This is an odd analogy, but from like an injury or something, where what happen, people will wonder, how do I get myself back, or how do I get her back exactly as she was? Instead, you think, all right, this is what's happening, this is the new normal, and how do we go from here to make the best version of us as a couple, but also you as a person that's gone through this, and it is a major change. And so to try to say, oh no, we're just going to do something so that I feel 25 again,
Yeah.
you're not going to get there. So how do we make you, instead of that, how do we make you the best 55-year-old or wherever you are?
Yeah.
And that has worked a lot better. Hopefully that made sense, but it's starting from where we are now. And
It
let's
makes
make
a lot of sense. And I what you said when you started, that it took you a while to realize that there was
right.
this phase of life that was happening. You, like the women going through it, like the clinicians
The same.
serving
Yeah.
those women, it has all been the same. And so I'm imagining, and speak up as freely as you like. I know, oh, by the way, we're gonna have a support group on this very topic with these two in November. So we'll unpack a lot more privately, if you will, then.
Yeah.
But as much as you'd like to share, because I'm also imagining there was an overlap between your personal lives and your professional lives, and
Yes.
conflation, right? Of like what was happening in office and what was happening at home that like really drove this to the fore. Can you talk about that?
Yes, Kate.
Yes.
Tell us.
So I'm 55, and
Yeah.
I have always had high functioning ADHD. I like to think of myself as high functioning, but high functioning ADHD, and I managed it really pretty well without medications, and by structuring my environment to accommodate that. And that is but that no longer would work for me. Well, I started noticing things like word finding, which is, and my friends and I always were like, oh, well, the nouns go first, and my mom would say. And so, but it's secretly, you're actually terrified that your brain is no longer reliable.
And even though she was terrified, I was thrilled that she was actually asking me. what she says, what word am I looking for? And I could name it. And she's the English major doctor. You know, she's a foot smarter than I am. And
You
I
were
would
just
go,
happy to be leaned
oh,
upon.
I was so,
Is that what
yeah,
you're saying?
to be
Okay.
useful. Call me when you need me.
I love it. Okay,
So,
go
yeah.
on, Dr. Kate.
So anyways.
Yes. And so it wasn't just like you say that the symptom that you get, yes, I would get night sweats occasionally, and it's so intermittent. That's the thing that is so hard to pin it down, I think, too, because with your ovaries working sometimes and then not working sometimes, the intermittent nature of it is also makes you gaslight yourself, like, oh, maybe I'm fine now, but then it would pop up and you would have these days where you were not fine at all, and it might not even be, oh, every 4th week I'm going to feel this, because your ovulation might become completely erratic, and so you don't know when things are coming. And at home, they don't know who is going to be walking in the door. So they don't know if it's the person who is totally easygoing and expecting to have, well, I don't know if I've ever been that easygoing.
Yeah,
but,
no, I get this.
It,
Like,
it would be, but they don't know whether is going to be someone who they have to all be walking on eggshells around. And that's a hard, and especially if you have teenagers in the house, it makes it a whole lot. They may not walk on it. They may be stomping the eggshells.
Right. So so we have two kids, Jack and Crawford, and Crawford is a girl, and she was leaving for college, and Kate was. It was a day of many tasks
they
to
have
be
challenges
completed.
and tasks.
Yeah, many. And Crawford got in her car to go to school and patted me on the back and said, "She's all yours now."
I'm out here.
Don't leave me.
Wait,
I
so
thought about
Jay,
furthering my education.
so Jay, I first of all, Dr. Kate, I really appreciate your candor and honesty. I think that more people in unions with other people are going through something like this than we even kind of find to talk about. And again, like, there is this conflation of, like, I'm getting older, I'm less inclined to say yes to everything, I'm less inclined to sort of like do for everybody else. And then there's this hormonal layer that can really make you feel not yourself. And I certainly hear that a lot. I experience that a lot. But Jay, I'm really curious, as a partner, as a practitioner, what how did you come alongside? Where did you kind of find a place where you both were like, this is what's happening, and here's how it would help if you showed up, here's how it would help if you could turn the dial down? Like, what was that conversation at home, and what was it in office?
Well, you'd be surprised at how similar the conversation at home and this conversation in the office
Yeah,
is.
no, I'm not. I'd love to hear about it. Yeah.
I'm just going through the same thing. In fact, when you can tell stories in the office to couples or to guys that are our age, it really helps them, because they don't feel alone.
Yeah.
And then hopefully you can share some wisdom. One thing that I'll hear a lot of guys say is they themselves will say, I haven't changed. I'm not sure why I'm in trouble these days, or I can't understand why I'm why there's tension, why things are different. Not necessarily tension and not necessarily trouble, but just why things are different. And a lot of them will also, they'll explain the same symptoms, and I will explain back to them that their wife is often working from a negative, and not a negative as in bad, but negative as in void. They will be able to tell you what they don't want, or what they don't like, or what they don't like about something, this new fate, or this new thing, or this whatever it is that's going on. but they can't tell you what they do. Like, and so I will explain it to couples. It's as if you're saying, I'm thinking of a letter. It's not R. That doesn't,
Right.
it doesn't do you a whole lot of good.
Right.
And so if you can start thinking of, all right, well, these things that I don't want, or that I don't like, or that I don't want to do they all have something in common. All right, well, let's take that group and put it to the side and see what part of it you do want to keep. And that really, and hopefully I'm answering your question, but that really helps with couples, and it helps guys understand where everyone stands now, where everybody is now.
One of the things that we talked about is that resentment, which I think people get these things built up in their relationships, and they have the same arguments again and again. Just resentment is just unspoken need. So it's if you're resenting something that's going on, it might be that you need to just translate that into what it is that you do need. And that's where you're saying it's not you have to try to work on communicating with each other. Say, okay, you came in today and you were irritated that everyone was watching TV, and you saw that the dishwasher needed to be like, how do we make it so that when you come in to the house, you're not explosive? Because you shouldn't need to, as a woman, a lot of times what we would do is just come in and we'd be like, well, nobody unloaded the dishwasher, so I guess I'll do it. And that's resentment.
Yeah, for sure.
And everybody else doesn't know why they're in trouble.
Right.
And what you're really wanting is to fill this need of, I just want to be able to walk into the house and not have to immediately start doing another job.
So when our kids were little, they were doing their homework, and I got this idea from so our friends the Socias are watching this, and Barry used to finish a project in his house, but if his wife left, sorry if I'm getting him in trouble now, but he would wait until she came back to put in the last screw with the drill, and he's like, all done, and it's just, and it made her happy.
I'm familiar with that trick.
Right. So, but if he had finished and taken it all down and is sitting there watching football when she walked, it's a different feeling.
Right.
So our kids were doing their homework, and Kate came home, and I was home already, and Jack says, "Mom's home," and Crawford said, "Everybody looked busy." so, but I did. I started unloading the dishwasher. And Kate was like, "How's everybody doing?"
That's great.
So it
part
worked.
of the thing that I see with the hormone changes that when and especially with we are juggling more than ever at this time in our lives, at work and with possibly parents, friends, all kinds of things, because we are at the top of our game. We really are at the time of our lives where we are able to, we have the experience to be the leaders, but we are concurrently having this dysregulation of our brains where the dopamine receptors are no longer getting the stimulation from estrogen. And so now our carousel of things we have to do, which we used to be able to be like, okay, let's put another thing in there, and as it comes around, I'll take it off. Now it is spinning at an uncontrollable speed. And so if you are trying to be the manager of all these things, if you come home and you add another animal to the carousel, when it was already full, and your brain is
incapable of managing.
Incapable of managing. And then the serotonin, which also can help with mood regulation, is also dysregulated. So you cannot, the way that things are working in your frontal cortex, people are like, I lost my filter. And that's absolutely true. Because the way your brain works with the frontal cortex is lets you choose the right words at the right time. And
Mm.
if that's dysregulated too, then you get the explosion that gets you, which you want to have these things done, but being able to regulate and choose the time and the way to achieve that is
That's so helpful.
And you would
yes.
say, and just to finish this point, that you would say that there would, the carousel is spinning at 100 miles an hour, and you would be upset when something got added to it, of course. But then once one of the kids, or once I would say, all right, nobody add anything else to mom's life, then you would be upset that you can't
Sure.
help out your family.
Right, because you
Sure.
also want to be the
You also
caregiver.
want to be the caregiver.
Totally get that. Totally.
Yeah.
That's such a great call out. Such a great point. We talked earlier about menopause sort of reshaping a woman's sense of self.
Mm-hmm.
How can, just to sort of put a final point on this, but how can partners adapt, and should they adapt when her identity is evolving?
Don't leave me.
Who'd like to begin? Who'd like to begin? Dr. Kate, you want to start?
Yes,
Yeah.
yes. And so as her identity evolves, I will say this. I will often, I would give someone that is living with a lovely person whose identity is evolving, this advice, and that is, if it gets difficult, if she is in a battle with herself,
Right.
it's I want to. So now, if she's in a battle with the way that she's feeling, and I don't mean in a battle with herself in the way that she's feeling, it would be, do I make this decision or do I make that decision? Do I say this to this person that I'm angry, or do I not say this? Or and it becomes a decision again, not in a battle because whatever, the dog peed on the floor or something like that. But so if she's in a battle with herself, I've told patients to say, if you're in a fight with yourself, I'm not going to pick a side.
Okay.
So it's almost, I'll listen and
Mm-hmm.
I'll help if I can.
Mm-hmm.
You have to be real careful not to offer advice other than, hey, if you go down this road, this would probably happen if you go down this road. But you just wait on the decision to be made. And so a lot of times I've noticed just in the past 5 years, when she's upset, it's often upset with Kate A and Kate B having to make a decision.
Interesting.
And does that make sense?
It
And
does
so
make sense. Is that what it feels like for you, Dr. Kate?
I think it is. I think it's you have these feelings where people are like, I just don't feel like myself. You're trying to figure out who that is, and everyone goes through evolutions and in their relationships and in your whole but this is like a fast forwarded explosive evolution, and of trying to figure out what is valuable in what you had in your 40-year-old self that you want to bring forward, and what things do you want to claim, what things you want to leave behind, and what things you want to claim for your future. And and it is and it's hard to do that when you are feeling out of control. And your brain is changing in a way that can be where you can really claim that what's valuable for you. But it also you don't want to blow up some of the things that you have in your relationships. And it is it's an evolution, but mostly it's communication in all of these things about what is going on. But it's hard when you don't understand what's going on in your own head.
right. And yeah.
I would be remiss if I didn't project for a minute and say
Sure.
that when I was going through much of this, when my late husband and I were going through it together. It was really, really difficult. And the thing that helped largely for me was getting on MHT. And it allowed me to just kind of like chill out and sort of feel myself again. And I didn't realize, I don't think, how bad I was feeling and sort of poorly I was managing until I was like evened out again.
And I think that one of the things that's difficult about OBGYN and our OBGYN training historically is that we did not address perimenopause almost at all.
Right.
And this transition was just something that you just had to suck it up. And even to this day, I have patients who go to their gynecologist and have seen people, and they're like, well, we can't really give you menopausal hormone therapy until you're in menopause, which is ridiculous because we really are trying to, and we call it MHT, and it's easy to call it MHT, which is menopausal hormone therapy, but really we want to look at precision endocrine therapy. That's really what we need to offer women, because when you lose your regulation of these things at 35 or 45, you deserve to have the opportunity or the discussion about, hey, if I added back a little of estrogen, a topical estradiol patch so that my follicle stimulating hormone didn't get so crazy spiked, would that keep me from and we gave a little base to where that estrogen is dropping, could I feel like my brain chemistry was a little bit back more in balance?
Right.
Maybe, and there's as many ways as there are to manage things in perimenopause, because it's the most difficult time.
Yeah.
Because your ovaries are still contributing sporadically. As many ways as there you can. Some people do better with progesterone. Some people do better with estrogen. But you should at least have the opportunity to have that discussion of, could my brain chemistry get better and ultimately impact my relationships by smoothing that out. That is something that women deserve. It's not just menopausal hormone therapy, it's precision endocrine therapy. And it's just and it really has to come from someone who has a commitment to working with you and figuring out where you're going to fall, because it's not a straightforward, like, oh, if I give you this much metoprolol, your blood pressure will go down this much.
Right.
It's much different,
right,
and much more nuanced.
I want to get us segued into a conversation around sex and intimacy for a moment, but as I was listening to you and just reflecting on what I had just shared, I want to just highlight that for anyone listening and who will listen to this conversation, it is not your fault that things have maybe gone wonky in your relationship. That's not to say there aren't things that aren't challenges in your relationship, like from day one, maybe, and maybe those things feel louder and look brighter than they did 20 years ago. But I just think it's really important. And also, as I'm thinking about some of the things you've said, Jay, I'm thinking it, and it makes me think of my own
husband,
who was sort of like, I haven't really changed. Like I'm just sort of who I was. So there's this kind of like lean into how she's doing and not so much how he's doing. And so I guess I want to ask you, Jay, like, would you say that that's something that you found in your practice, that most men feel like, it's not me. I don't know what's happening. I've really just been like the same guy that I've always been, but she really seems to hate me now. Or are men also going through something that?
Well, certainly men are going through some. I can't jump as high as I used. No, but Certainly men are, yes, they're going through their own thing, but men are often problem solvers, and so it's not as if they come in and they say, I haven't changed, I give up. I mean, it's not. What they're really saying is, I haven't changed. And when you get to the end of the conversation, they have, first of all, tried to just weather the. I'm going to use flashier language than it
Okay.
actually is, but I'm just going to try to weather the storm. So they just try to kind of wait it
Wait it
out.
out.
Or retreat. I mean, that's
Well, they end up there. So they weather the
Okay.
storm. Then secondly, they try to fix it. They try to get involved, and they try to at first just make guesses at what it is that she needs. And then it will go to a brief discussion of I know you're trying to help. Hopefully it's you're trying to help, or it could be you're not helping. and then it'll go to anger. It's almost like the stages of grief or something. And so it'll go to anger because you've lost the relationship and you're not sure why. And
Right.
so then there's some yelling back and forth, and then there's retreat. Then there's just, all right, I'm going to take myself to another room.
Yeah.
When, and I mean, you can, it's not good, but you can understand. I mean, the gals that when she gets like that, I just leave.
No, I appreciate
That's
that
terrible. I
candor.
mean,
I do. And one of the reasons I really wanted to have this conversation is because, like you guys said, you want relationships to work out, right?
right, right. Oh yeah.
And and at the same time, I have heard women say, like, I'm done, and also he feels done with me, and not to be so like dire and make it sound so
Right.
horrible. There's a lot of reasons, of course, for a union to unravel, but also like I've seen women here in the comments saying like my relationship's been really great. He's really come alongside me. And so that would be whatever relationship you're in, whether it's your marriage or with any other partner, you want that anyway, right? So go
Correct.
ahead, Jay. You look
Oh
like you're
yeah,
about to
yeah.
say
No, I was going to say, yeah, I saw one of the comments. Somebody said that I'm on HRT and my libido is still tanked or whatever.
something.
And that's the kind of things that you'll hear. The triangle that kind of takes place is you have the hormone replacement therapies, so forth, estradiol, so all the magic meds, and then you have to end up healthy. Those have to work. I mean, you
Right,
have to be on the right one. Okay,
right.
so obviously you have to be on the right one, but also the part that is really important in what I see is that life keeps going.
Yeah.
If you had zero menopause uh,
symptoms.
symptoms, see, most of the time I'm asking her for the word. So if you had zero symptoms and you were just cruising through, life still happens. You still have kids that are going to school. You still have you have your job, which you're just rolling in, or if you've retired, then it's what's my purpose? And all of these things can bring you down.
Yeah.
I mean, I don't mean to make the scope of this conversation go
No.
infinitely in all directions, but
I get it.
but that's something to think about. It's
Well,
let me make sure that if I get the right medicine, this actually fixes the problem, and there's not another problem in the relationship.
Right.
and connection. I mean, so
Right.
when women's sexual function, if we were going to go in this,
Let's get there.
women's sexual function and men's sexual function follow a same sort of path, but it is it's definitely very different in how we go through these phases. So
Yes.
men, even though they don't think they change, they do actually change, and they can have some they could have problems with decreased testosterone. About 40% of men in midlife have that, and they can have problems with some sexual function. But for the most part, the problem, if we look at these different phases of sexual function, so you look at desire, arousal, orgasm, resolution. So
the chart we all saw in 8th grade.
Yes,
Yes.
in sex ed. So the problem is that men mostly are at desire about 80% of the day, I would say, and then
I'm there right now.
TMI.
Okay.
But
We'll be done soon.
then,
We'll wrap
and
soon.
their biggest problem is the arousal.
Right.
And their arousal, it has to do with blood flow. Sorry, he totally threw it.
That's okay. I know.
So their problem is a blood flow problem.
Right.
You know, so it's a vascular problem.
It's physical.
Yeah, it's physical a lot of times. And so with women, desire is where we can't get to arousal because we can't get past desire. And there's 2 types of desire: spontaneous desire, and then which was just like I'm sitting around thinking about getting it on, basically. And then there's responsive desire, and that is where we say, and sometimes I talk to my patients about marriage maintenance sex, basically, where you're like, okay, I want the closeness, I want all the good things that I feel and how it makes our relationship closer, but I don't have, and so to get that, I'm gonna initiate or participate in sex, but I don't, and once I get into having sex, I am able to respond and get to that arousal. But a lot of times, if we look at long-term relationships, that spontaneous desire starts to diminish very quickly. So when we look at studies on desire and sexual function, a long-term relationship is anything over 6 months, you start to see diminished desire.
Really?
So if you get to 27 yeis, it's going to be, and then you have all these other things popping up. Then you say, okay, but is it bad to have no spontaneous desire? Not necessarily. I mean, if you have responsive desire, that's where most people live in their relationships. So that, but sometimes women say, okay, well, even when I am able to get into that, the tissues of I've all these hormonal changes in my tissues, and so the tissue of the vagina, and yes, we in this point in our relationship, my husband says vagina on the regular. Nice. Whereas most it's evolved. The tissue of the vagina is very responsive to hormones, and so some of my patients start having dryness with sexual intercourse just in the time of right before their periods. It's that responsive, and so you can get these women who say, I'm still having my period, why am I needing to use lubricant now? Right. And it's because those tissues are actually changing. They're not producing as much fluid, and eventually they'll get to the point where the tissue thins and may even become more constricted, and so you're getting pain with intercourse. And if you think your brain is not going to spontaneously want to have sex, if you add any pain into that, it's going to just shut that desire center down altogether. And it's bad. Sometimes you don't realize it's bad for both partners if either one of them is experiencing pain with intercourse, because it makes the anxiety portion for your partner very high because they don't want to hurt you. But it also, so fixing the tissues, how do you do that? And so adding back some vaginal estrogen, just like this much, this is about 1 gram. And so you can add a little bit of vaginal estrogen once or twice a week is all it really takes to get that tissue, because there's so many estrogen receptors in that tissue that it's highly responsive to a very, very low dose of, and vaginal estrogen is safe for essentially everyone. You can when we start our breast cancer patients on their treatment, if it's going to decrease their estrogen, we start them on vaginal estrogen because it is not shown to increase their mortality from breast cancer or a recurrence of breast cancer. And it protects if you look at the studies, if using vaginal estrogen, even in breast cancer patients, will decrease their all-cause mortality.
Yeah, I'm so glad you brought that up. I'm so glad you brought up vaginal estrogen. I was gonna get that in there if it
Yes.
didn't come up. It's critically important, and it's not too much estrogen. If you are also using systemic estrogen, you
Absolutely.
should absolutely be using both anyway to
Yes.
just protect the integrity of your vaginal tissue, your vulva. I want to ask you both, and Jay, I'll start with you. What creative ways do you suggest couples explore closeness again? Because closeness can change, as you both kind of laid out. It isn't necessarily always like getting in the bedroom and getting it on, and things do change for any number of reasons
Right.
between couples. But how do you keep it? How do you keep close?
I can't believe I'm actually going to go to our last discussion of estrogen, and just to make a quick point, and then answer this question.
You want to talk about more about vaginal estrogen?
No,
we can talk about it all day. I'm here.
but no, but the last thing I thought 6 months ago in my life, if you had told me that I'll be speaking at a menopause conference in Chicago, I don't think I would
know
have.
you wouldn't have imagined it.
I wouldn't have imagined this ever. But what's funny is that my guy friends here in town, they know what I'm a part of, and they know the podcast and so forth. But so many of them have come up to me, and I mean, it can be at a bar, it can be, and they'll come individually, and they will say, "Hey, my wife is experiencing blah blah blah. Is there something, seriously? There's something
That's
that can be done."
amazing.
Isn't that great? And so
Yes, I
it
love
really
to hear
is. And I
that.
mean, so I don't know how much use I am other than telling you that, guys, man, the thing that we want is for all of you to feel your best. I mean, we are totally on board, and we just know nothing about it. And until recently, nobody knew anything about it.
Yeah.
And so the difference that's being made there. Now, how can a couple stay close? Intimacy is the word I like to use in therapy, and not sex. Certainly, you have to use the word sex, but intimacy is that closeness, and is so important that you feel all the time. So it's the touching of a hand, it's the pat on the bottom, it's the leaning in to listen. It's so much of that is, it just gets ignored. And listen, guys are, mostly at fault. Yeah, we're at least, I mean, I would say we're mostly to blame, because we can go from 0 to 100.
Yeah.
And so when they can't, and guys have physical intimacy to experience emotional intimacy, and women are the other way around. And so you have to stay connected emotionally. You have to stay intimate. You have to, again, it's the,
So for women, emotional intimacy leads to physical intimacy.
Right.
And
not just the marching orders of let's go get it on.
Right.
And so you're trying to just, I would say, if anything,
we wish that would work.
I know you do. I know you do.
So it's doing the things and that that are going to, where people, the trope is that nothing is sexier than a man doing the laundry, and it's true. It's just like taking things off of her plate, figuring out what it is that means love to your partner. And so trying to, if it is the touch, if it is the, hey, I noticed that you have had these things riding around in your car to take to the post office for a week or two. Can I drop these things off at the post office for you? It was, and just say,
That's what I get to do whenever I drive Kate's car. It's full.
I love that.
A project.
I love that.
Projects of jobs.
Yes, things on the carousel. And so just finding what it is that means love to that partner, and trying to say, okay, this is an investment in our intimacy, and because sex starts in the kitchen. It starts with seeing each other and connecting well before that, but also that if your partner is struggling with, you don't want every touch to be a sexual touch,
Right?
Because that's the other thing is that I say you're in bed together and you don't want your foot to touch his foot just in case he might think you might want to have sex, but being able to say, hey, I can we just like spoon today, and setting those expectations that and giving yourself a little bit of time to say, this is not a good time right now, but I really want to connect with you. But,
We're getting close to an hour. Thank you for giving
yes.
us all this time. I want to end on something empowering, because this stage isn't just about loss. It's also about rediscovery, and threaded in everything
Yes.
you've said is not just like change and loss, but change and togetherness. And so I want to ask you both, Dr. Kate, you just spoke, so I'll start with you, Jay. What do you want women and couples to know about what's possible on the other side of menopause, sexually, emotionally, and relationally?
Well, I see a lot of, I would say, if I have to make a guess at the age, mid 60s. So 65 and up, I see the happiest couples. If they come in, then they are there often because a grandchild is having trouble, or a kid is having trouble, and now they have the grandchild, or I want to retire, but I'm da 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 da. I mean, man, they are there. And so I see a finish line all the time. And
That's so
so
great.
it's the 45 to 65. I mean, and it's, if we can get through that as smoothly as possible, knowing that there's bumps along the way, and knowing also when you have made improvements. I will tell people that they'll come in and they say, well, we fight all the time, just for example. And my favorite question is always, who's winning? Which is, but they never have an answer for that.
No, I
But,
bet.
we fight all the time. And then suddenly we work together and they don't fight for 2 weeks and then have another one. Let's say they have, another one. And they come in and they say, well, we fought again. Well, wait a minute. You had 2 weeks where it was great. So you fought once in the past 2 weeks and you used to fight twice a day.
Right.
So to know when there is change for the better, for the positive.
Yeah. That's great.
And you can't think of this as loss. I mean, because there's so many great things that are going on at this age.
Yeah.
I mean, finally, most of us have a couple of nickels to rub together. Finally, most of our kids, they may still be doughy in the middle, as Kate says, but they're coming, you know what I mean? You're not chasing around a 3-year-old. I mean,
Yes.
Again, that was great that time. But so much can be freeing, and gosh, anything you're looking at, from dinner with friends to vacations to projects that your wife wants to assign you. There's so much.
There's liberation,
potential and positive, and these people hit it at 65. I mean, they're there.
Yeah.
And so there's some point where you get there.
Yeah.
And and it's just, can we? What's the smoothest road? And it's not going to be completely without potholes, but what's the smoothest road? And this is what we are. And what women are struggling with, this is the way I see it. This is what women are struggling with. When they were 35, they picked up 4 toys between here and the front door. You don't have to do that anymore. So now this is the new thing to overcome, to battle, and to stay positive in
And I
doing
think
so.
it is great. You are having remodeling of your brain and your metabolism and all those things, and you're having to totally recalibrate how you think about your relationship and how you think about your body. But once you see this as a normal change and normal evolution and normal recalibration, and see, okay, if I can communicate here and I can own my voice and here, I can really focus on the things, it can crystallize the things that are important to our relationship, but also in your own direction.
Yeah.
And so when that sense of empowerment is wonderful, and it can really bring you closer. And if you are having the same fights again and again, and you take it to, okay, what is it about this that's important to my partner?
Mm-hmm.
And
Mm-hmm.
and say, okay, if this is important, how can we make this grow together? How can we make this a positive for both of us, and have that communication? You end up with a stronger relationship, whether that's your relationship at work or with your friends. But you can get rid of some of the BS and leave that behind and come through as a little bit more streamlined. And that whether and you may need to do that and to try to find the healthiest version of you physically and mentally. So hormone therapy can be that for a lot of people. Psychological therapy can be that for people. It really is, and then certainly all the health aspects we go on it. But it's really about finding that voice in your head that's going to take you to where you want to be. And some of that is just having it settle down a little bit.
Make you the best you.
Just really quickly, before I ask you one final question, we're speaking to women a lot who are a lot younger now, right? The landscape's like sort of shifting towards women in perimenopause and women, post 30, post 35. If you could quickly tell me, each of you, what you would want those younger couples to know kind of before they get to deep into perimenopause, what would you want them to know about this season, Jay?
Well, I would start, make sure that communication is there and is clear. So I always go through. I'll do this in 30 seconds, but the ways we miscommunicate are we kind of drop hints, so we don't really say it. We just kind of, or the opposite of that is translating. So if they say something and we turn it into, so you're saying you don't like my mother, or whatever, you know what I mean? Or we just don't communicate. We just shut down. It's just, and that's another thing that guys are quite guilty of. But so if you can communicate, and even if it feels odd at first, or if it feels fake at first, it is my birthday tomorrow, I need flowers,
right?
That kind of thing. Even if it's that, then it's amazing how people will start to pick it up. So with anything, the psych answer, generally one of 3 psych answers you're going to get is communication.
Okay, great. And Dr. Haight?
Yeah, I think it is that you have to invest in your relationship. Your relationship is not going to take care of itself. And there are a lot of demands on your time and your emotional health during this time. But you have to take the time to invest in each other, and somebody can, somebody is going to be able to help with picking kids picking kids up from school, and ultimately you can Uber eat some food for your kids and things, but no one is going to be able to connect with your partner for you. So only you can do that, and if you don't do that now, while things are better,
Yeah.
you will not have that internal scaffolding when things are starting to get wobbly.
If I could get rid of one phrase in the world, it would be relationships are work. And the reason is...
Wait, that's just what I said.
No. But when somebody says that specifically, let's go get it on. No. But when they... No. You what you're saying is you have to work at the relationship. But when people say relationships are work, when they say that phrase, man, everything is work. Everything. If I want to learn a new song on guitar, it's work, especially for me. But it's worth it.
It's investment.
Cooking a meal is work, but it's worth it.
I love that.
What is more worth it than your relationship?
I love that. What a perfect place to end. Guys, thank you so much. You gave me a lot of time. I can't wait to bring this into support group, which we'll have next month with both of you together. It will be fun. And I have so many questions. Many you answered organically without me having to ask you, but really many more that I want to get deep into, and we'll be able to do that there. Just thank you for the work that you do, and for being open, smart, and funny about a topic that doesn't always feel that way. I just want to remind people who are watching again that there's a code to take advantage of over on myalloy.com that's good all month in celebration of Menopause Awareness Month, and that code is MENO25, and you can connect with an Alloy prescribing physician. Maybe it'll be Dr. Kate, which will be
in South Carolina and Colorado.
Yes, perfect. So I think, my takeaway today is just to kind of keep the conversation going between yourself, your kids, your family, your significant other. Take care of each other and listen. And thank you. Just a pleasure.
Oh, you're welcome.
Guys, go get it on.
Great to see you.
Go get it on. If that's feeling right.
We have to go now.
We gotta go now.
Go.
All right, bye guys. Thank you.
Bye.
Bye.